Okay, it is 10 o'clock Pacific time. I am Dr. Joanne Yanez. I'm the Executive Director for the Association of Accredited Naturopathic Medical Colleges. And with me today for our webinar on food as medicine is Dr. Cory Szybala. He's joining us from Idaho, and we are all in our homes, as we should be. I hope that you are all safe and healthy out there. And I'd like to introduce our speaker today, who's going to be talking about food as medicine and how naturopathic doctors use something as basic as food to help us heal. So Dr. Szybala, before we begin, I just want to do a little housekeeping. So there is a Q&A box. If you open up your Zoom, there's a little box for Q&A. So if you have any questions during the course of the webinar, please put those down in there. Don't use the chat box because we won't be checking that as much. Dr. Szybala will speak for about a half an hour or so, and then we'll have time for question and answer, and he'll get to answer all of those. So I would like to just introduce our speaker. He's a licensed naturopathic doctor who believes in helping his clients discover optimal health with integrated and an individual approach. He's committed to providing quality naturopathic care to men and women of all ages, and enjoys integrative family practice with special interest in men's health, pediatrics, blood sugar dysregulation, and digestive health. In his willingness to listen to the whole story and dedication to integrative health, that's what drives his patient care. He was a student at NUNM in Portland. He developed a passion for clinical nutrition. It was during this time that he discovered and quickly became a member of the Food as Medicine Everyday series. And it's still going at NUNM. It includes 12 workshops demonstrating simple techniques for selecting and cooking delicious, nutritious whole foods and how they influence our health outcomes. Born and raised in the Midwest, Dr. Szybala was mostly influenced by conventional healthcare, but after graduation from Indiana University, he realized there were other types of models. And so with that, I am going to give to you, Dr. Cory Szybala. I'm going to make my face go away, but I'll still be here in the background listening. So thank you all for showing up.
Perfect. Thank you so much, Dr. Yanez. So as Dr. Yanez was saying, I will move forward here. I am from the Midwest originally, so Indiana University, go Hoosiers if there's anybody out there. And, you know, part of that is part of my journey, the fact that I started out there and started kind of going through like the hospitals and worked in hospitals as a high school student, luckily, I got to learn a lot about medicine and learned a lot about a lot of different types of medicine. It wasn't until I basically went out to the West Coast, as you can see, Portland, Oregon was kind of my next stop, and found out that there is another type of medicine out there, and I was intrigued, to say the least. I did a lot of research prior to, so in the university, I actually got a biochem degree, and so research was kind of my first step into the medical field. It's something that I really enjoy still to this day. So worked over at OHSU, Legacy, Providence. If anyone's from Portland, you understand those are some of the hospitals out there. And then during my time out there, I actually learned about this thing called natural medicine and naturopathic medicine, to be more specific. And that's when I decided to start my journey into that. So it was this idea of true primary care for me. What's preventative? How do we kind of work on things before there's a bigger issue? And then how do we look at the whole picture? And that was one of my biggest kind of eye-opening experiences. As Dr. Yanez said, I worked at the Food as Medicine Institute since its beginning. I was originally a student that helped put the whole thing together, which was awesome, absolutely incredible. I'll talk a little bit more about the Food as Medicine Institute and their series throughout my slides. And then as far as practice goes, while I was at the Food as Medicine Institute, I was also practicing an integrative clinic in Portland, as well as teaching in the Masters of Nutrition over at NUNM. So let's get started here. So using food as medicine in a clinic it's easy to say, but difficult to do. And so a few things I want to kind of hit on this specific webinar is food medicine? Is medicine food? What makes food a medicine, and what makes medicine food? So these are kind of back and forth, but a lot of times when people say food as medicine, it can be tricky. And I know there's a lot of people out there that think, no, it's not a medicine, it's just food. And then there's a lot of people out there that say, well, medicine could be food then. So what I started with is just a few different definitions to basically get us kind of started here. Food is a material consisting essentially of, oh, sorry, I got a question in front of me here. There we go. Material consisting essentially of protein, carbohydrate, and fat used in the body of an organism to sustain growth, repair, and vital processes to furnish energy. Something that nourishes, sustains, or supplies. I really like that type of definition with food. So let's take a look at medicine, a substance or preparation used in treating disease, something that affects well-being, the science and art dealing with the maintenance of health and prevention, alleviation, or cure of disease, a substance such as a drug or potion used to treat something other than disease, an object held in traditional American Indian belief to give control over natural or magical forces. Medicine can be a lot of things, it turns out. So, I think those two together, we can say that food could potentially be used as medicine. I think the hardest part is that sometimes we can go down a path with that and go where food isn't food anymore, and it's actually medicine, and vice versa. So we'll talk about that as well. Now, one of the things that I always work with my students on is we have food, we have medicine, but then we have this third thing. We have poison. A substance that through its chemical action usually kills, injures, or impairs an organism. Now, just as food can help us, and it can help us grow, it can help us become vital, and just the same as medicine can do the same, we have this third option. And I think that one of the things that we forget about is no matter how nutritive something is, we can also create a poison out of a lot of things. And it turns out as human beings, we do that quite a bit. Anytime someone kind of self-medicates or eats too much or does this or that, we can create something that's actually causing more harm than good. And so I always like to bring this up just because of the fact that when you go beyond that moderation, when you go beyond that type of maybe preventative care or treatment model, and you become so entwined into making this one big change in your life, whether it's food or something else, you can actually create a poisonous factor in your life. And so putting all of this into perspective, let's go into how we might actually use this in our integrative practice. So let's see if I can get this guy. There we go. Alrighty. So one of the things that I always try to tell people is you are what you eat. Everybody knows that. That's fine. But there's a little bit more to it. And I think that's where naturopathic medicine for me really became a great place to start with a lot of folks. Is it's not just what you eat. You can tell people to go leave your clinic and eat an apple a day. That's fine. But if their digestion isn't working, if they're not able to absorb the nutrients, what's going to happen? And then I add that third or the fourth one, which is assimilate. So when people come in to see me, there's commonly an issue with a difficulty to digest, absorb, assimilate any specific ingredient. And that's why medication was started. That's why supplements were used. When we look at that whole picture, again, the whole point of using food as medicine, but also naturopathic perspective is we look at what's going on entirely. We can't just say, eat these things, they're gonna be amazing for you. We don't know that yet. And so as you start to look at more and more of the research on some of these different foods and some of these different diets and et cetera, you find out that there's a lot of counter talk. And so a lot of research actually says one thing, but then it says something else. Where do you start? And that's where we come in. So the first thing we like to do is I like to break it down into kind of 4 different things to think about whenever you work with your clients using food as medicine. So the first thing is accommodate. You have to know where they're at. Educate. So you need to educate yourself, but you also need to educate your clients. Empower. So part of that accommodation, that education is actually empowering. And then succeed. You need to know when you actually complete something or when you don't. And so it's really important for you to know if I give you this timeline to be on this diet or this nutrition, I should see X, Y, or Z. I'm going to go into those a little bit more. So accommodate means meet your clients where they're at. We hear this all the time. Where are they coming in from? What is their financial background? Do they have any sort of deterrence to health? Do they have any comorbidities? any specific healthcare needs at this time. What's acute, what's chronic, can they cook, do they have a kitchen, do they have a stove, do they just have a microwave? I've worked with people in all of those different categories, and you can't tell someone that comes in and say, you need to only eat bone broth. And they say, I don't know what the heck bone broth is. I don't know how to make it. I don't have a slow cooker. I don't have a pot. I don't have an oven. We need to discuss those things and really decide what is possible. I've also worked with people who didn't know how to boil water. And so when you're telling people to go home and cook something, you can't just say, you need to cook let's say a DASH diet, and then not give them any resources to this. So, this is all part of it. The other aspect too is, and I think this is part of, probably more important than anything else, is understanding their food philosophy. Food to everybody is more than just sustenance. It means a lot to both their emotions and their mental happiness. And so when you take something away or you give something to them, you want to make sure it's something that they're actually willing and able to try or do. So these are very important aspects to just that first step. So before you even start talking to them about what nutrition or diet is necessary, you really need to know, where are they coming from? What can they do? What are they willing to do? Next, we educate. So, part of education, and for us as naturopathic physicians, we understand the pathophysiology, the etiology of any specific disease state. That's only one aspect of it. The other thing that we need to know is, how does nutrition affect different parts of the body, but also how does all of our methods affect different parts of the body? So when you look at different cooking methods, when you look at different disease processes, when you look at what pharmaceuticals people are on, there are always interactions. There's always chances that whatever food you're saying, yes, it's high in this, but if you cook it this way, that it's going to become really low in this. We need to know that. So there's a lot of different moving parts about how and what. This also goes back to that philosophy standpoint. If someone's been only cooking on a grill for their entire life, and you tell them, oh, you got to go home and just start doing low and slow in the oven or in, boiling water, it's going to change how they kind of think about it. And the first thing is, with food, you want to make sure it tastes good. And so if you're using food as medicine, you can't just tell them, go home and eat some of this slop. It might taste good, but you really got to cook it slow and low. So you're changing everything about their ability. And then they're going to try it for about a week, and they're going to come back to you probably in a month, and they're going to say, that didn't work at all. So when we think about this, we really want to be sure that we are taking the time to really kind of break down what is going on, what do they have access to. One of the things that I worked with in Portland was food deserts. So people actually didn't have access to healthy foods. They had access to gas stations or 7-Eleven. So we had to work on how that worked into their own lifestyle. The other thing about education is kind of understanding the trends. And so I use this slide quite a bit. It breaks down the top 10 causes of death based off of income. One of the things I really want to point out here is the blue versus the red. So red is communicable diseases. Those are things that are more having to do with the fact that we don't necessarily have the right sanitation. We don't really have the right medication for specific zones, or maybe there's too many inhabitants or less doctors in that area. So you look at low income areas or countries in 2016, a lot of it's red. So the next thing I want you to kind of do is just kind of scroll through and come to this high income country where most of it's blue. So the reason why that kind of switch happens is we're no longer having issues with sanitation. We're no longer having issues with not having clean water, etc. What we're having is a disease state of sometimes excess. And so when I look at this, most of the ones in blue are actually reversible by just nutrition and lifestyle alone. And so whenever I work with people on these, especially ischemic heart disease and stroke, those are extremely important to start considering. If we can change diet and lifestyle, we're going to make a huge impact in this long term. And that's my goal with most of my clients. The other aspect down here is Alzheimer's, cancers. The more and more research that's coming out right now, we can see there's a lot we can do to affect these things. And as we learn more about genetics, as we learn more about the microbiome, et cetera, we're going to learn more and more about what we can actually do, which is really neat. So going back to that education standpoint, if these are the main causes of death in these countries, well, we need to consider, what are we doing to educate ourselves on this? You know, the other aspect of this is what has changed from 2000 to 2016. So you look at not only income, but you also look at time. And so with the time, you start to see that same aspect of that blue becoming much more prevalent. So what I do as a practitioner, and so for some of you who may be interested in nutrition, interested in naturopathic medicine, or just interested in health overall, I use something like Google Scholar first and foremost, and or Google. It's pretty easy just to kind of research what's the best diet for cardiovascular disease. The fun part about this is you can actually decide what timelines you want to see. So you can actually see the trends of which diet did what at what time. Many of you know, who have been around for a little bit longer than some of the others, that dieting is never consistent. Everyone says this is the best diet or this is the best diet. And so what I like to do is really go into those scholarly journals and decide, this is a person who has maybe cardiovascular disease, but what other comorbidities do they have? And by comorbidities, I mean other diagnosable issues that they may be having as well. So do they have diabetes? Do they have high blood pressure? Do they have rheumatoid arthritis? Do they have, you know, so there's a lot of other things that go into it. So when I look at somebody, I can't just say, yes, this one diet's going to be good for you because you have cardiovascular disease. No, a lot of times what I end up doing is actually create a tailored or a modified version of a diet based off of that person's individualized needs or personalized needs. So I just kind of show you cardiovascular disease, one of the main things that are going on, a ton of research on diets, things that we need to stay up on as far as best practices, diets, etc. The next thing that we look at is Alzheimer's. It's a huge issue right now. One of the things that has recently come out is, you know, some people call Alzheimer's diabetes type 3. You know, so we understand that there's a microbiome component. We understand that there's maybe a sugar dysregulation component. And after reading more and more about some of the different diets, you know, there's ones that are long-term, there's ones that are short-term. So that's the other aspect that we need to think about is it acute? Is it a chronic case? Is it something that people can do? So the other aspect of this too is it's nice knowing all of the different diets that are out there that are related to diseases or disease states, purely based off the fact that if I'm first thinking about someone's philosophy with their food and what they're willing or able to eat or cook, then I also need to consider where they're at and then what I can start them on. So a lot of times what I'll do is if someone doesn't want to make a big change, we start with the starter diet and then we go from there. So again, that modification is always happening. Diet and cancer. Boy, you know, I think this has been around for a long time. We know a lot about different foods specific to cancer cells, specific to the immune system. We're learning more and more about this every day. As we learn more and more about each specific cancer, we'll learn more and more about each specific dietary or nutritional need as well. The other thing that I really like to look at with this specifically is what treatment do they have? And then what dietary needs or nutritional needs might they need during that time as well? So as a preventative doctor or an integrative practitioner, we work with people on all of these bases. I just put this one in here just because these are kind of like the top 4 that, you know, you see on that list before. And so it gives you an idea of what different diets are out there, as well as how much information is out there. And it also gives you an idea of, boy, we really don't know some of this either. And so that's the hard part, sussing out what's right, what's wrong, what actually has good literature behind it, what doesn't. That's what we do as practitioners. That's what we're supposed to be doing as practitioners. You never stop learning and you continually try to stay up to date on things so that way you can help your clients out as best you can. So a lot of different diets out there. How do you choose what's the right one? Where do you start at? Where do you go from there? These are just some of them. Again, I do a lot of men's health, so this is actually from a different presentation I was giving, but you know, from just looking at cardiovascular disease alone, all of these diets are recommended. And so you really have to decide what's the best one for the person sitting in front of me. You know, we always look at research as how many people were studied, and that's great, but we always have to remember we have an N of 1 in front of us. So that's an individual with individual needs, individual medications, individual side effects, etc. You know, family time, are they working, are they not working? You have to think about all of these things at once. And so you use all of this, but you find out what's going to work best for them. So it's nice to have a plethora of possibilities to give, but we don't know how that's going to work until we start talking to that person in front of us. And then empowering. You know, one of the things that really turned me on to naturopathic medicine is the fact that I worked in a hospital in regular or allopathic medicine, as they call it. And a lot of times people are like, well, you need to eat healthier. And that would be a prescription. What I learned from that is a lot of people don't know what that necessarily means. I heard you have to eat healthier, you have to go on a diet. And, you know, when you do that, you're not setting someone up for success. And so if you're not willing to take the time to empower that person that's sitting in front of you, to try and teach them some of the techniques, some of the methods, some of even just having access to some of the different resources that are out there, ultimately you're not going to set them up for success. And that's already setting them up for failure. And so for me, when you can empower someone to take control of not only their diet or their nutrition, what that ends up doing is it gives them a lot more empowerment to take control of their health and their life overall. And so the fun part for me as a practitioner, working with people and using food as medicine, is you really get to see them change who they are, change how they're doing what they're doing, and you get to see the positive side effects of that. So being a cheerleader, being a beacon, being a provider, a source of knowledge. You know, a lot of times what I do is I'll have someone leave my office, I give them a lot of information sometimes, or I give them very little, depending upon what they can handle at that time. And I tell them, if you need anything else, you just go ahead and email me, because I have resources that they don't have. I can find things faster than they can. Plus, the other aspect too is there's a lot of miscommunication or misinformation out there. Realistically, I want them to come through someone who can actually suss through that better than them trying to do it themselves, because A, it's labor intensive, and B, they can end up going down the wrong path without realizing it. So one of the things that I told you guys I would kind of talk about is the Food as Medicine Everyday series. It is absolutely life-changing for a ton of people. I've seen people come in with looking for weight loss, looking to reduce inflammation, looking to reduce prediabetes. And through this 12-week hands-on cooking class, we were able to do that for a lot of people. So instead of promoting necessarily a diet, we try to promote a lifestyle with it. So promoting whole foods and low processed foods. Simple enough, but for a lot of people that's really difficult. You really have to meet them where they're at. Encourage a mostly plant-based diet. If they are going to eat animals, how do we know if it's a healthy animal they're eating from? Promote an anti-inflammatory food choice. Understand that people have unique food needs as well as philosophies. Care about food and production of it. So that's the last one that's kind of on there. In Portland, where we originated this all, and with the help of Charlie and what am I thinking? Bob Moore. Sorry, I was like, I know those guys. So Bob and Charlie Moore. One of the things that we have access to over there in Portland is there's a ton of farms, there's a ton of local food, there's a ton of amazing things that we can really decide, like, okay, do we need this banana at the wrong time of year that's coming from Mexico, or can we eat something that's local? And ultimately, we know that there might be some more nutrients in it. It might actually be better for us because of the time of year. So we start to look at all of these things together. So again, how do you kind of promote a lifestyle versus a diet? And that's what I always try to do with people is we try not to say diet. We try not to say we're changing your food, you know, whatever. We're trying to change a lifestyle for you that is healthier, because to make something sustainable, they have to think of it as a sustainable approach. And so when you start really just looking at, okay, what are some really basic things that we can do? You can just start with some of these options here: portion control, understanding that there might just be healthier options for some of the things that you're doing, sodium intake, understanding the difference between healthy and unhealthy fats, how to include more vegetables in your diet, where to get them from, you know, understanding what the added sugars are, how many we're supposed to be having, what's the maximum limit, things like that. You know, I think a lot of times we get into our head about how complex something can be, but a lot of times we can actually really make it pretty simple if we just choose one of these and stick to it for a little bit, and then we can go forward from there. The other thing to consider with lifestyle is maybe not necessarily the food basis, but more along the lines of the actual lifestyle basis, which is stress, alcohol, smoking, exercise, weight, moderation, talking through things. You know, for me, men's health is a lot of it's stress and a lot of it's not talking. And so it's a great place to start with people. If you can open up, if you can give them an outlet, if you can give them access, you know, a lot of the other things fall into place. And again, this is that whole meeting people where they're at. How do you meet someone where they're at if they're not willing to talk about it, if they're completely stressed out? Any food you're going to give them isn't going to be helpful, because that's just not going to work. I mean, again, you go back to that: you are what you eat, digest, assimilate, etc. So it's all part of that common goal of what's that holistic model looking like. And then succeed. You know, for me, whenever I look at success, it's you assess again. So you give them what you think is the best thing for them. In a month, in 3 months, in 6 months, in a year, it might change. So you have to be ready to pivot and then repeat the whole process over again. And so, you know, when you look at something like this, you may never be done necessarily. You know, sometimes I give people something and they're like, this is working, and it works for 5+ years, you know, and I say, great, that's amazing, keep it going. But a lot of times there is this kind of approach of, okay, we need to change. We need to switch something over because it's not working for you. And you need to be open and accepting of that, because someone comes in and life changes, and we know this is all part of it. So to give you guys a case here, and sorry, I'm going pretty fast. I apologize. I hope you get these slides. If not, I'll figure out something. But this is one of my favorites. 62-year-old female came in with rheumatoid arthritis was her chief complaint. Moderate to severe. Went to a rheumatologist, was saying, hey, we can put you on these drugs. She just didn't want to be on any drugs. Comorbidities. So what other things were going on? Prediabetes, osteoporosis, and a history of estrogen receptor positive breast cancer. The only medication that she took was ibuprofen as needed for her arthritis specifically, so her hands. Diet was pretty similar to the standard American diet. Had access to her own garden, so she was eating some fresh vegetables, which is cool. But all in all, it was mostly processed foods and things like that. So what do the labs look like? Hemoglobin A1C was 5.9, so pre-diabetic. HS-CRP, that's high sensitivity CRP, that's 23. It's elevated. So anything above 10 is considered elevated. That can be due from inflammation or kind of that acute pain that's coming on. Blood pressure, slightly elevated, systolic, 130 over 82. Vitamin D was super low, 30 nanograms per ml. So this is actually at the low end of normal. I like to see it above 50 for most people. So, you know, when you start to look at all of these things together, prediabetes, osteoporosis, rheumatoid arthritis, you have to start considering, okay, what are some of these other factors that we have to consider as well? So for her, the MCPs were swollen and warm to touch bilaterally. Those are the joints, the knuckles on her hands, worse index, middle, right finger. So she would wake up and sometimes her right hand wouldn't work at all. So it makes it very difficult to wake up and maybe have a cup of coffee, which is something that she really enjoyed. And even reading a book made it really difficult. Knees, elbows, and wrists were swollen, bilaterally stiff, difficult to bend in the morning. So not only the hand, but also, you know, imagine getting out of bed and you just feel like you're stuck. It's not a very fun feeling. So we wanted to really get her kind of feeling better as soon as possible. And knowing that she wasn't willing or wanting to go on any medication, we had to come up with something fast. So our treatment was a modified paleo-like diet. with emphasis on whole food. Since that standard American diet was already out there, that paleo aspect of that meat and potatoes was something that I considered. You know, a lot of people can do paleo different ways. And so I always like to make sure that I try to push the healthy version, which is, you know, really thinking about the whole food aspect and that different variety of vegetables. The other reason why I use it sometimes with people as a starter diet is mostly because the resources. There are a ton of resources out there to use. And then also I had her avoid alcohol, dairy, and gluten for at least 1 month, just to see where we went from there. I did provide a supplement of anti-inflammatories, vitamin D complex, and then had some daily weight-bearing exercises once she was able to. So I didn't want to, you know, start her off and again start her with something that she was going to fail. So I told her, let's give it some time, but we need to get these in here. And so I gave her a whole list of them of, hey, maybe we can start here and then we can go up from there. So just an idea. Follow-up 1 month, swelling and morning stiffness decreased significantly. It was absolutely incredible. You know, we did a video conference call and she was doing this in the morning. Oh, I don't know if you guys can see me or not, but basically she was, you know, opening and closing her hands. It was awesome to see her. Increased energy, also a nice side effect of everything, increased range of motion. And you can imagine that her all around mental health was 100% better. Was still interested in adding in dairy and gluten. So what we said was, let's start a 2-week trial of dairy only. 2 weeks later, I get a message from her and she says, swelling and morning stiffness have come back, not as bad as before, but are present. Feeling really lethargic midday, unsure as to why, not feeling 100%, doesn't know what's wrong, but has been eating dairy for 2 weeks. So, you know, this is the thing too, is a lot of times what I do with my clients is, again, you're trying to meet them where they're at. And a lot of times you do have to challenge some of the things that you take out of their diet. You know, what I always try to do is I lead with the things that they're going to have. And then we, you know, discuss the things that we're going to take out. A lot of times what we do is, you know, you really have to also understand how long something will take to take it out of the diet and then give it back again, because sometimes that diet, what it will do is it'll actually change how their body perceives it. So once she started putting that dairy back in, everything started coming back, which is a real bummer for her. Decided to take dairy back out again, wait 2 weeks before trying a gluten challenge. I always like to wait before trying any other types of challenges, just because of the fact that we don't know what's overlapping. We don't know what the cause is without that. So I never put 2 things back in at the same time. Now, that being said, sometimes my clients do. And that's a bummer because sometimes we have to go back through this entire process again. But that's part of that assess, pivot, and then repeat type of approach to success. 2 months later, so no dairy, no gluten, still on this modified paleo diet, goes back to kind of the way it was before. She also noticed another great side effect was her allergy symptoms actually improved. She usually has annual spring allergies, and those weren't as bad this year. Based off of that, she was also not interested in trying gluten anymore, comfortable with her current regimen, and was happy with where she was at this point. So we kind of just kept going doing this. You know, I think okay, I couldn't remember if I was like, I forgot if I have the third follow-up. So third follow-up, it's really fun to run labs on people, just because of the fact that, especially if you know things are going to be changing. So based off of before, she had a 5.9% hemoglobin A1C. This is 4.6 now. Her HSCRP was 23, now it's 8. Her blood pressure improved. Her vitamin D even improved in these 3 months. So, you know, knowing how much can change on a lab factor can sometimes be that that deciding factor of if that client's going to continue on with something, or if they're just going to say, I'm done with it. Which can be difficult because sometimes labs don't change that quickly. I was lucky enough, and she was 100% set on doing what I told her, which is amazing. So when you have 100% compliance, things do turn out a little bit better than others, but it's not always the easiest thing to do. Again, on the bottom, history and physical exam. Swelling and morning stiffness is almost gone. MCP is still slightly affected due to previous inflammatory injury, but range of motion is good. Energy is consistent throughout the day. I think a lot of that has to do with that pre-diabetes, as well as her probably eating those processed foods and added sugars, etc. So you can see just in 3 months what can happen. Since then, this is 5 years ago, I think. I've still worked with this same person on time and time again. Little things will come up and we'll just switch something. And we either see results or we don't. If we don't, we switch and we go to something else. There's a lot of different things we can do to help and improve people, especially with all the new research coming out and staying up to date with it. So that's my whole thing. I kind of went through that a little fast. I do apologize about that. I am a fast talker, so being from outside of Chicago, it kind of works that way. But one of the things that I was asked from Dr. Yanis, and then I don't know if you want me to go through this or not, but I really quickly, she asked me what I love about naturopathic medicine. My favorite thing is spending that time and really personalizing a treatment plan. My biggest issue with medicine before I learned about naturopathic medicine was the fact that there was just a short-term goal, and people thought that, hey, I don't need to spend that much time with people. As a naturopathic physician, I find myself more as a counselor, as a cheerleader a lot of times. I'm happy doing that, and I love doing it because I get to see people change what they're doing, how they're doing it, and I get to see the positive effects of it. The other thing is that large toolbox. There's so many things that we can do dietarily, supplements, all sorts of different things. I mean, it's not just pharmaceutical and surgery. It's not just saying, hey, you need to go do this. It's spending time with people and really learning a little bit more about them to really empower your client. And then ultimately, it's just helping those who need it. It's a lot of fun and it feels good. What am I looking forward to? Sorry, I forgot what I put in here. Continue to learn, discover. Right now, my wife and I just moved back to her hometown in central Idaho, and we're building a practice. And it's always a fun time to do that. It's always a stressful, intense time to do that, but it's really fun as well. And advice for anyone who's looking into any sort of advanced kind of medical training: discover your passion first. Know what you're going into. Never stop learning. Don't be that person who thinks they're the best at something, because you're not. Ask questions and be curious as much as you are from the day you started. I think that's everything. Yeah. Well, thank you guys so much for listening. I appreciate it. And I think I'm going to take your questions now, I believe.
Yes, if you can just go to the next slide really quickly.
Yes, I can.
Also, we had requests to put the poll back up for some folks who attended, got in a little bit late after it closed. So we're going to put that poll up really quickly again. But we hope to see you at some future events. We will be hosting naturopathic medicine approaches to a healthy gut next month, and then allergies. Although I think allergies might even be hitting us a little sooner than May. They've already started in my neck of the woods. But we'll be talking about allergies as well. We always have events, so stay tuned. If you don't get our newsletter, sign up for that too, so you can stay attuned to what we're doing. So with that, I'm going to go to some of the questions that we've received. So the first one, I think, there's always so much questioning, Dr. Szybala, about cooking methods. And, do we consume it raw? Do we lightly steam it? What is the impact of processing of food, which cooking is a process of food, on phytonutrients, vitamins, minerals? And do you have any references or resources for that you would recommend?
Oh, it's a large can of worms to open up, but yeah, 100%, yeah, exactly. I think I have a ton of resources on different things. I would also suggest doing that Google Scholar search and searching specific nutrients and how cooking may affect it. That'd probably be the easiest way to do it. That being said, there's a ton of really cool books out there as well. I can't think of any off the top of my head, but some of the more medically based cookbooks actually have some of that specifically. And then I know that the USDA also on their website, they actually have like a full nutrition and how things break down. So it's something else you can kind of take a look at. That being said, yes, we do affect our nutrients. Some actually become much easier for us to get by that processing. So cooking can actually help release some of the nutrients that we need. Eating raw sometimes is better. It's always a common thing where someone's like, I only do this. And it's like, well, you may not get everything then. So whenever I see people who say that I only do one thing, I already know right off the bat that, they're not willing to change, or they're not willing to accept that maybe something else might be positive, and I that's always the hardest part. I'll say this, it's dependent upon the specific nutrient. It's dependent upon the specific cooking method. What I generally tell people, and this is just kind of like, if I was going to tell people one thing to try and get the most nutrients, but also be the healthiest, is slow and low. A lot of times people cook things too fast. And yes, it may taste great that way. But the problem is that you can easily lose a lot of those nutrients with those high temperatures and too quick of heating. So if I can leave you with that, hopefully that kind of answers your question. And I'll see if I can find some more resources for you as well.
Excellent, thank you. And I was kind of reading between the lines with what you were just saying, but we have a question about supplementation. And I know that this is a topic of food as medicine, but when do supplements play into the equation?
Sure, that's a great question. Whenever I work with clients, I always discuss a treatment approach, and then I always discuss a maintenance approach. And so a lot of times what I do is say, listen, you have a vitamin D level lower than 30. We can start adding vitamin D in, but we know that the D3 is the easiest for you to get that level up. And so whenever we think about how do we get something up to a point where it's sustainable and you can start feeling better. So a lot of times what I do is I use supplements when people need to start feeling better sooner than I know that the diet or nutrition can actually do that for them. So I use it as a true supplemental approach to their health. And I barely use supplements long-term. There's a few that I might, especially if I start looking at their genetics and things like that, knowing that they have a true issue with maybe metabolizing or changing something. But a lot of the stuff I do is short-term. And if we can get them on a healthy diet or a healthy lifestyle as well, I shouldn't just say diet alone. A lot of times we can take some of those things away. And that's how I like to use them, and that's how I think they should be used.
So there's a question here about the 2-week period in your practice, and folks were just a little curious if you could speak to that, and why 2 weeks, why not a month? How did you come up with that?
Which 2 weeks? I apologize. I'm trying to.
I don't know. Jessica, if you can expand upon your question a little bit.
It might have been in the case that I was talking about where, that person actually contacted me after 2 weeks. So generally what I do is I give everybody a month
Yes.
to start with. Okay, got it. So I generally give everybody a month to start with. So whenever someone comes in, I say, this is what the next month is going to look like for you. We'll decide what's going to happen next after that. Some people, I'll say, this is your next 3 months. If they know they can't come back in, we try to create something that's going to work for them. I barely ever see people every 2 weeks unless they're going through something so acute that I'll see them every other day if I need to, purely for the fact that I want to make sure that they have everything they need to succeed and have everything they need to know what's going on, and they're not feeling afraid at home as well. So.
Excellent. So a question just came in here about something I know I've spoken about before, which is mindful eating.
Ooh.
And if you're not familiar, I'm happy to answer that, but I'd like to throw that your way a little bit.
Yeah, absolutely. So part of actually the food as medicine philosophy, we actually have an entire day out of those 12-week series where we actually talk about mindfulness with eating. It's very common. And when we first started that whole entire program, we had people who would eat at their desk while they're working or looking at a screen or, eating in their car. I mean, we're all guilty of it. Trust me. I still do it to this day. I know I shouldn't, but it's one of those things that it's part of life. One of the things that we look at is that original presentation slide that talks about we are what we eat, digest, break down, assimilate, etc. I think that's really where that comes into play. We have something called the sympathetic versus the parasympathetic. When we're in the sympathetic fight or flight mode, our body does not digest well. As you can imagine, running from a tiger isn't a great time to eat a burger. And so when we can actually take time to get ourselves in that parasympathetic mode, it does wonders for not only our digestion, but our mental health as well. So what we used to do is before we ate, we would actually sit there. We put one hand on our chest, one hand on our belly, and we breathe into our belly 10 times before we had the bowl in front of us. We wanted to eat, but we had to sit there and breathe 10 times to slow everything back down again. Because when we go at it from that fight or flight, we're not going to digest well. We're not going to assimilate well. And then you're not going to get the nutrients that you actually want out of whatever food you're cooking, no matter how healthy it is. Excellent.
I know just in addition to that, some of the early literature was out of Cornell University on mindfulness eating, and that we consume more calories, we eat more food when we're not being mindful of our of what's going in our mouth. And it's always interesting. There was years ago when I went to Europe, we rented a car, and I looked at the car and like, they don't have cup holders. Why don't they have cup holders in this car? And it's because you shouldn't be drinking on the go. Like, it's not the culture. You sit down, you have your coffee or tea properly, and
Yeah. And I'll say that just to kind of piggyback off of that, one of the other things that we actually taught in that class was how to sit back down and have a family dinner, or have a dinner with people that you love, whether it's family or just friends, etc. Like we get caught up in this world where we don't even eat at a dining room table anymore. And so just simply having that kind of ceremony around a food will change how you look at food, how you enjoy food, and how you enjoy the experience of food.
Yeah. So anyway, I think I do want to move on because I'm just cognizant of the time here.
Oh yeah.
But one last little piece of do you have any resources for folks on mindfulness?
Oh, so many. What I often use for people just to kind of like start the box is the 4-7-8 breathing. Dr. Andrew Weil actually has a great video on his website. And then the box breathing, which is, I actually prefer if you're going to like look up box breathing on YouTube, Bulletproof. I don't know if it's Bulletproof Radio or whatever. They have one that's really, really simple, but it just basically teaches you the basics. And then as far as like meditation, things like that, I really love the app Insight Timer. It's free. It has thousands upon thousands of different things based off of how you're feeling and where you want to go. And so, just something to consider. These are some of the places to just get started, and then you can kind of go from there.
Okay, thank you. So, I think there's one other thing that I always think of with mindfulness eating, and that's just, and like you said, that hand on the belly, but also the just taking a pause for a second and checking in with yourself. And okay, before I go and grab for that thing, am I truly hungry? Am I thirsty? When was the last time I ate? And will this food choice move me toward health and my goals, or away from health and my goals?
Absolutely.
And just having that one kind of practice of being present when you're eating and centering yourself and asking, okay, is this moving me toward where I want to go or away from where I want to go? And sometimes, there are things that birthday cake or whatever, that you're going to make a conscious decision and say, yes, I am making a conscious decision that this is a choice that I want to make, and I understand the ramifications of making this choice, and I'm making it anyway. That's still mindful.
Well, and that's one of the things that I tell all my clients, everything in moderation, including moderation, right? So you don't want to go too far one way or another, but at the end of the road, you want to make sure your mental health is there too. So, if eating that piece of that cake with your friends is part of what makes you happy, that might be just exactly what you need that day. So I appreciate that. That's really, yeah.
Can you speak a little bit about fasting?
Yeah,
Can you
very
also put
cool.
the previous slide back with your address, the addresses on it?
Oh, yep, if I can, I'll try.
Mm-hmm.
There we go. Yeah, no, absolutely. Fasting is, it's become such a hot topic right now. And I think most of it really comes back to the fact that a ton of the research that's been out there is reduced calorie intake can increase longevity. And that's something that we've known for quite some time. We just didn't really have a cool way to do it or a neat way to kind of do it. And so now they've created different methods towards fasting. So the 16-8 or the 5-2 are probably the two most popular. 16-8 means that you only eat for 8 hours of the day. And then those other hours, those other 16 hours, you actually do not eat anything at all. The research behind it basically comes back to the fact that, again, that lower calorie intake overall can actually improve longevity. But part of that is that longer time away from food will actually improve your immune system. It'll actually take a lot of the things that we have issues with, and it gives your body time to actually use the resources that you're giving it to actually like rebuild or restructure from that. So, you know, sleep is one of the things that I think is one of the most important aspects of life. And when we sleep, we have a lot of that recuperation kind of happening. And if we give ourselves that extra time away from food, we can actually have the body to work on itself rather than trying to work on the food or something else that we put in our body. I hope that's sufficient maybe for that person.
Yeah. And you know, I know it's always controversial. I know I've talked on organic produce versus, you know, conventionally farmed fruits and vegetables. Can you speak maybe to, you know, the nutrient qualities of commercially grown vegetables and, you know, just a little bit about that?
Sure. Yeah, no, absolutely. You know, I think the studies that have been done on organics, and not even just organics, but I like to include biodynamic, even home farming. There's so much more to that nutrient-rich soil. And again, I'm coming from the Midwest where we grew corn and we grew soybeans. And if you drive
And more
west from
corn.
India, yeah, if you drive west from Indiana, you'll see soybeans on one side and corn on the other, pretty much all the way to Colorado, right? So it's all part of it. And so what you end up finding out is that the problem with having the same crop on the same field every single year is you end up decreasing the nutrient content of that soil, which then decreases the nutrient content of the food that's coming out of it. And so what I always tell people is, when you can eat something wild, and there's a great book, Eating on the Wild Side, that kind of discusses this specifically. When you can eat something that's wild, it actually, what we're trying to get mostly out of each food is actually its own immune system. So if we can get some of their immune system, then we can actually improve our health from that as well. So they're going to have more vitamins, they're going to have more nutrients, they're going to have more phytonutrients, et cetera, based off the fact that they've actually had to survive, rather than being in a place where they were cultivated and then given everything they needed to grow. And then we don't actually get the same quantity of nutrients. And there's tons of studies on this over and over again. I mean, you can just look up organic versus conventionally raised, whatever, and you'll see just a bunch of information on this. It's almost overwhelming, but it just makes sense if you can eat the organic. If you have an issue with, let's say, financial, what I always tell all my clients to do is the environmental working group always comes out with a clean 15 and a dirty dozen. Awesome resource to have. You should just have it on your fridge or in your pocket at all times. It tells you basically which foods are the best to eat conventional, which foods are the best to eat organic if you have any sort of issues with that. And they come out with one every year because it changes based off of how the conventionally raised model is actually growing some of these things.
Exactly. Now, you mentioned Eating on the Wild, and I'm wondering if there are any other books, without thinking of a lot of a lot of brain space there, but any just that pop off the top of your head that are some of your favorites.
Eating on the Wild Side is definitely one of my favorites. I'll say this for people that really want to just kind of get like the basics of nutrition down. I do love Practical Paleo by Diane Sanfilippo. She's actually a nutritionist, and her book is awesome. It is very paleo based, but the first like 60 to 100 pages are all about how things end up happening to your body through nutrition. I think it's a great way to learn something. And then the other aspect, or the other book that I would consider, is the Food as Medicine Everyday book. It's an awesome book. I'm not just saying that because I helped, create some of the content, but it's such a great beginner for nutrition that you get to learn so much from it. And both of those, the Practical Paleo and the Food as Medicine Every Day, actually have the recipes in the back, which is really fun too, because then you get to try different things out. Gosh, I have a library of books. There's so many. I love books. I can, I read them every day and I just eat them up. But those would be kind of like my starting points right now.
Fabulous. And what about recipes? I know folks who are trying to, eat more whole foods, cook more at home. Are there any repositories? I know the FAME site has had some.
They have some. They don't have as many as they should. I'll say that. That was always something that we were working on. This is one of the reasons why I use that paleo aspect with a lot of my clients. Is you can look up amazing paleo recipes. And the thing is that you don't have to be 100% paleo, right? You can add in beans, you can add in grains if you want to. But they start you off with a whole foods approach, which is what I really enjoy about it. And there's just so many resources. So you can say, boy, I'd like a paleo this, and that's what I usually end up writing. And then you actually end up seeing all these different recipes, and then you get to modify them any way you want to. So yeah, those would be some of them. I do have, I'm trying to think, on our website, so the www.svnaturalmedicine.com, in our resources page, I have like some of my favorite blog sites, some of my favorite recipes on there. So people can go ahead and take a look and see. I can't remember off the top of my head, like my favorites right off the bat, but if they're interested, you can look at our resources page, and there's a bunch of really fun ones on there that I really love.
Awesome. So I'm wondering, I know we just have like another minute or so. Can you maybe think of your favorite advice for, your favorite piece of advice for a patient trying to get on track with nutrition, and what is the best thing that they can do to, regardless of whatever diet it is they're choosing, but what is it that's the most supportive that you've seen in your years of counseling folks for helping people to stay on track?
Yeah. Boy, one piece of advice is always difficult because, again, it goes back to that N of one individualized approach. But, what I often talk to people about is it comes up wherever they're at. And my biggest thing that I usually end up working with people on is portion control first. A lot of people who maybe haven't been using that mindfulness approach to food, haven't been thinking of food as a sustenance, as a nutritional source. A lot of times they do overeat. A lot of times they don't think about what they're eating. And so taking that time to pause beforehand and really taking that time to think about what they're eating and making a conscious effort of it, I think that really comes back to them more so than not, because they can do it when they're in the grocery store. They can do it when they're out to eat. Just tell them, take a pause for a second, smell what you have in front of you, look at what you have in front of you first. That starts the digestive process. I mean, one of the things that we used to do in the Food as Medicine group is we'd actually run people through a sort of like a mindfulness approach where we have everybody close their eyes. We tell them they're in their kitchen. We have them cut a lemon. This is all, in their head. And then we have them put the lemon in their mouth. And then usually within a second of that, everyone's like, I'm hungry. So, just thinking about something, taking that time to really kind of get your body ready for what's about to happen, rather than just shoving food in. I think that's probably the biggest difference that I see for most people.
Awesome. Well, I know we are basically out of time, and I know that there are a couple other questions that have come in, but I do want to thank you so much for joining us today for our webinar. For anyone who still has any questions, please email info@AANMC.org. We'll be happy to get you any information, get you the slides, as Dr. Szybala said earlier, and we hope to see you again at another one of our webinars. And to all of you who are hopefully in your homes and hunkered down. And to you, Dr. Szybala, thank you for coming. And I wish you all to stay healthy and safe in this very unique time that we're in. And remember that food can be medicine.
Thank you so much.
Thank you for coming. I appreciate it. With that, we're going to wrap up today's webinar, and I really appreciate it, and we'll hope to see you at another event.
Bye, guys.
Bye-bye.